Başladı hocam.
Good morning. I want to talk about today about the focused abdominal sonography for trauma assessment. This is a kind of diagnostic imaging technique for trauma patients in multiple trauma patients. We use this imaging technique for over 20 years more. And nowadays, recent years, it is embedded in the Advanced Trauma Life Support Guidelines. It took 3 or 5 minutes long for providing this diagnostic imaging for these trauma patients, and it is an easy diagnostic method for multiple trauma patients. First of all, I want to talk about when we use this technique. We use this technique for unstable patients, unstable trauma patients, and we use this ultrasonography screening method for the unstable trauma patients. And when we see the free fluid in the abdomen or pericardial component in the pericardium, or when we see a pneumothorax in the lung, we do some procedures, or we send our patients to the operating room immediately without any other diagnostic imaging method. So we use fast array probe for the focused abdominal sonography for trauma patients, and don't forget to use your gel over your probe. And first of all, we start from the upper right quadrant of the abdomen, and we just try to see the Morrison portion, which is the space between the liver and the right kidney. So I put my probe in the line of the mid-axillary line, coronary plane, coronary oblique plane. So when I put my probe at the mid-axillary line with the coronary oblique plane, you see the probe marker. You see the probe marker toward the patient's head, and in the screen, I see the probe marker. I see the screen marker shows the patient's head, and this side, the left side of the screen, shows the patient's feet. So this is the upper part, this is the lower part, patient's head and patient's feet, and the diaphragm, and this image shows me a liver image, homogeneous liver image, and the horseshoe-shaped organ, or this image shows me the kidney, and this space, this white space, shows me the Morrison portion. And this is the first image that I have to take while I do focus assessment sonography for trauma patients. When the free fluid exists in the abdomen, this space will show anechoic black area, and it represents the free fluid of the abdomen. But now I see the white line between the liver and the right kidney. I have to see the lower pole of the right kidney while I do first examination to this patient. And this is the first image of FAST. 90% of the time in the unstable patients, I can see the free fluid just by looking at horizontal portion, well, between liver and kidney, 90% of the time. You can elevate your patient's legs to the air and 45 degrees, and this increases your sensitivity of plasma screen. And the second image I took in the first examination as the supraspheral window of the pericardium. For seeing the heart from supraspheral view, you have to put your probe first under the right costal margin, and you have to see the liver here, and when you go, after seeing the liver, when you go through the supraspheral area, and when you aim your probe towards the patient's left shoulder, you will see the left lobe of the liver, and underneath the left lobe of the liver, you will see the heart chambers clearly. As you see, the nearest part of the heart toward the liver represents the right side of the heart, right ventricle, right atrium, and the distal parts of the heart represents the left side of the heart, left ventricle and left atrium. You can easily pick up the pericardial effusion or pericardial tamponade from his view. This is the second image of the chest scan. After that, I just go to the left upper quadrant of the abdomen to see the space between the liver and the left kidney. I put my probe towards the posterior axillary line, a little bit coronal oblique plane, to see the space between the kidney and the spleen, and I'm trying to pick up the free fluid between the spleen and the left kidney. But don't forget, in trauma patients, when there's bleeding at the left upper quadrant of the patient, the fluid collection will occur at the upper part of the spleen, not between the spleen and the left kidney. First, you will pick up this fluid in the patient's abdomen at the upper side of the spleen between the diaphragm and the spleen. And this was the third image of the chest scan. And the fourth one is the retropubic space, suprapubic area of the patient's abdomen. And I am trying to catch a free fluid at the rectal bladder area, and I am trying to see if there is any free fluid posterior to the bladder. And this is rectangular shape bladder, and this is the space that I am trying to use. I am trying to pick up the free fluid in this area. I put my probe to the suprapubic area of the patient and probe marker towards the patient's right side, probe marker and the screen marker towards also my side, and I'm aiming my probe towards the patient's feet to see the bladder more clearly. As you see from the image, I show my patient's bladder in a rectangular transverse fashion, and when I change my probe position towards the patient's head, I see the bladder and the longitudinal patient here to see in the periphery at the posterior area of the bladder. Please place the fourth image of the breast scan. And in an unstable patient, patient with an hypotension, after I examine the periphery in the abdomen, and also after I examine the pericardial tamponade in the heart, whether it is present or not, I want to check another disease that can cause hypotension to the patient, which is pneumothorax. To see if a patient has pneumothorax or not, I use my, again, phased array probe. You can use linear probe also. I use phased array probe, and I put my probe towards the mid-clavicular line of the patient, and probe marker shows the patient's head, and on the ultrasonography image you see the probe screen marker shows the patient's head, and the other side shows the patient's feet. And then I put my probe here. In the image you will see the costal shadows here towards the bottom of the image. Black area represents the shadows of the costa, and the thin white line between the two costal shadows shows the pleural line. This white line shows the pleural line. And this space is called Marvin space. If you look at this white line near, you will see that something like moving over each other, visceral and the parietal pleural line, walking over each other. And this represents that visceral and pleural line are comfortable, and there is no air between these pleural lines. So this image shows us that this patient has no pneumothorax. And I continue to screen this patient's lung towards laterally towards the mid-axillary line to see the all lung spaces, and you see pleural lines, visceral and parietal lines, running over each other, moving over each other, and shingling effect. And I can also see the pleural effusion or hemothorax by looking at the lateral sides of the thorax in an unstable patient in the trauma room. When you do this examination, faster. It took 3 or 5 minutes to see the patient's abdomen if there is any free fluid, or to see if there is a pericardial effusion or tamponade in the pericardium, or to see if there is any pneumothorax over both lungs, and you can easily pick up the reason of the hypotension of these trauma patients, and you can then manipulate or manage this pathology as soon as possible. Thank you.